So the first question is from Alexandra. She asks, can you discuss the significance of small secondary lung nodules found in CT scanning in patients with early stage lung cancer? Specifically, what percent progress to adenocarcinoma, and is there any work being done on therapies to prevent progression of these lesions?
Yeah, so Otterson, it's a good question. So a couple of things, I guess. Many of these small nodules, so-called indeterminate nodules, and by small, typically they're certainly less than a centimeter, probably less than a half a centimeter. I live in Ohio, so where we live, it's very common to have what are called granulomas in the lung, most commonly caused not by cancer, but by a infection related to a fungus that's endemic or lives in this area called histoplasmosis. If you live in the desert Southwest, it's or Southern California, the same kind of granulomas are seen, but it's a different fungus. So most often what will happen is if we detect some small nodules, we'll observe them. And if they're new, we'll sometimes say, get a repeat CT scan in 3 months or 6 months. And if they don't grow, and while this may be uncomfortable, we just not ignore them, but we just watch them. If they grow, then we may do a biopsy or multiple other sort of testing. So then the second question, what percent progress to adenocarcinoma? So for granulomas, 0% of them progress. That being said, the other finding that can sometimes be seen are these sort of pre-malignant or, I guess pre-malignant would be the best way to say it. Where this is especially well known, I guess, is in cervical cancer. So for women, you get a pap smear, and sometimes there's so-called intraepithelial neoplasia. It's just a sort of $2 word for sort of a pre-malignant change is seen. So the same kinds of things can happen in the lung. And depending upon the nature of these lesions, very few to a countable percentage will progress. Last question then, about what can you do about these if there's work being done. So yeah, it's a very vigorous research network looking at, it's sponsored by the NCI, looking at chemoprevention opportunities. Unfortunately, none of those have really proven to be effective. There's been a lot of work with vitamin supplementation and selenium, very large clinical trials with tens of thousands of patients that have proven to be negative. The most important thing that was identified in those is if a patient has these small nodules and they're a smoker, they should quit smoking. So like Gina said, the risk of getting a second cancer, for example, is extraordinarily high in patients who continue to smoke. One final comment. I'm sorry, I don't mean to sort of go on too much, but is the new thing that's sort of become of interest is can immunotherapy chemoprevention work, or immunoprevention, if you will. These are early days, so I don't want to necessarily say that that's going to happen, but it's of great interest right now.